Hello and welcome. Today we're diving into a condition that affects a woman's fertility, diminished ovarian reserve or DOR. We'll explore what it is, what causes it, how it's diagnosed, and what options are available for managing this condition. So, what exactly leads to diminished ovarian reserve? Unfortunately, pinpointing a single cause is often difficult. Age is the most significant factor, as ovarian reserve naturally declines with age. However, DOR can occur prematurely in younger women as well. Genetic factors, such as Fragile X syndrome premutation or other chromosomal abnormalities, can play a role. Certain medical treatments, including chemotherapy and radiation therapy, are known to damage the ovaries. Surgery on the ovaries, particularly procedures like cystectomies, can also impact ovarian reserve. Autoimmune disorders and even environmental factors are suspected contributors, but the exact mechanisms are still being researched. Sometimes DOR occurs with no identifiable cause, termed idiopathic DOR. Now, let's talk about what's actually happening in the body with DOR. A woman is born with a finite number of eggs stored within her ovaries. This is her ovarian reserve. With DOR, this reserve is significantly lower than expected for her age. This means fewer follicles are available for recruitment and maturation each month. The remaining follicles may also exhibit decreased responsiveness to follicle-stimulating hormone, or FSH. This hormonal imbalance and the reduced number of viable eggs contribute to decreased fertility and difficulty conceiving. Understanding the prevalence of DOR is crucial. While it's challenging to obtain precise figures due to varying diagnostic criteria, it's estimated that DOR affects a significant proportion of women experiencing infertility. Its prevalence increases dramatically with age, affecting a substantial percentage of women over 40 trying to conceive. While DOR is more common in older women, it can occur in younger women as well, sometimes even in their 20s and 30s, which can be particularly distressing. What are the signs and symptoms of DOR? Sometimes there are no noticeable symptoms. For many women, the first indication of DOR is difficulty conceiving. Irregular menstrual cycles, including shorter cycle skip periods, can also be an indicator. Some women may experience symptoms similar to menopause, such as hot flashes, night sweats, or vaginal dryness. However, it's important to remember that these symptoms can also be caused by other conditions, so it's crucial to consult a healthcare professional for proper evaluation. Diagnosing DOR typically involves a combination of blood tests and ultrasound. A blood test measuring FSH or follicle-stimulating hormone and estradiol levels is commonly performed early in the menstrual cycle. Elevated FSH levels can suggest diminished ovarian reserve, as the body is producing more FSH to try and stimulate the ovaries. Another important marker is anti-Müllerian hormone, or AMH. AMH is produced by cells within the ovarian follicles, and low AMH levels indicate a reduced number of follicles. A transvaginal ultrasound can also be used to assess the antral follicle count, or AFC, which is the number of small follicles visible in the ovaries at the beginning of the menstrual cycle. A low AFC further supports a diagnosis of DOR. While DOR isn't typically classified into distinct types, it's helpful to understand the spectrum of the condition. Some women may have mildly diminished reserve, while others have significantly lower egg counts. The severity of DOR can influence treatment options and success rates. Age is also a critical factor in determining prognosis. A younger woman with DOR may have a better chance of conceiving than an older woman with a similar AMH level. Unfortunately, there's no way to cure DOR or restore a woman's ovarian reserve to its original state. However, there are several treatment and management options available to improve the chances of conception. These include ovulation induction with medications like clomiphene citrate or letrozole, often combined with intrauterine insemination, or IU. In vitro fertilization, or IVF, is another common option where eggs are retrieved from the ovaries, fertilized in a laboratory, and then transferred back to the uterus. For women with significantly diminished reserve, using donor eggs may be considered. Lifestyle modifications, such as maintaining a healthy weight, quitting smoking, and managing stress, can also contribute to overall fertility. Supplementation with CoQ10 is sometimes suggested. Although scientific evidence supporting its effectiveness is still limited, it's important to discuss all treatment options with a fertility specialist to determine the most appropriate course of action. Currently, there's no proven way to prevent DOR. Since age is a primary factor, women who are considering delaying childbearing may want to discuss options like egg freezing with their doctor. Avoiding exposure to environmental toxins and maintaining a healthy lifestyle may also contribute to overall ovarian health. If you have a family history of early menopause or premature ovarian insufficiency, it's important to be aware of your potential risk and discuss it with your healthcare provider. The prognosis for women with DOAR varies depending on several factors, including age, AMH levels, AFC, and overall health. While DOAR can make conception more challenging, it doesn't necessarily mean that pregnancy is impossible. With appropriate treatment, many women with DOAR can successfully conceive. Recent research is exploring new avenues for improving ovarian function and egg quality, such as ovarian rejuvenation techniques, but these are still experimental and require further investigation. Continued research holds promise for developing more effective strategies to address the challenges of diminished ovarian reserve.